Hi everyone, I am Samantha Erickson, and I am here to talk about the human immunodeficiency virus today, also known as HIV. Just briefly, an outline of what I'll be talking about. I'll talk about HIV and the disease that it causes, the epidemiology, how the infection is transmitted, the reservoir, the clinical signs and symptoms, and I'll finish off by talking about treatment and prevention strategies. So HIV is a retrovirus, and it is the causative agent of acquired immunodeficiency syndrome, or AIDS. So people who have AIDS first are infected with the HIV virus. The HIV virus is an envelope virus with an RNA genome, meaning it is single-stranded. And a unique feature are these glycoprotein spikes that you can see on the cell to the right that really aid in adhesion and absorption into human host cells. The HIV virus works intracellularly, meaning it grows and multiplies after being engulfed by dendritic cells of the immune system. HIV and AIDS are highly prevalent, so I thought it would be interesting to share some notable statistics about the infection and disease. Worldwide, there are 34 million people currently living with HIV or AIDS all around the world, which is a lot. And in 2007, there were 1.7 million AIDS-related deaths that were reported. And a large amount, actually 70% of these cases, occurred in sub-Saharan Africa. And as you can see on the map of the geographical prevalence of HIV and AIDS worldwide, just HIV, you can see that it is most concentrated in the African region. This makes sense because HIV actually originated in Central Africa sometime in the early 1900s. The virus actually came from chimpanzees who were infected with a similar virus called simian immunodeficiency virus, or SIV. And SIV was transmitted to humans, where it was then converted into the HIV virus. And this happened through blood-infected game. And what I mean is that humans back in the early 1900s would hunt chimpanzees for their meat and to gain nutrition. And here, if a chimpanzee was infected with the simian immunodeficiency virus, the bloody meat was able to infect the humans. And HIV started off being secluded in small African communities until new social and sexual practices, as well as increased immigration, led to its widespread transmission, which is why HIV and AIDS are prevalent almost everywhere. HIV is transmitted through direct contact. This can be through sexual intercourse, blood-to-blood contact with an open wound, or the use of unsterile intravenous needles or injections. And these routes of transmission are very specific. So what I mean is that blood, semen, and vaginal secretions harbor high amounts of free HIV retrovirus, which is why that you can contract HIV through sexual intercourse and blood-to-blood contact. So humans are the reservoir for HIV and AIDS, and the virus is found in the blood, breast milk, semen, and vaginal secretions of these infected individuals. The progression of HIV, there are 3 stages. The first is the initial acute infection, followed by a period of clinical latency, and third, the final progression into AIDS. And I've attached a flow chart that actually is helpful in seeing how exactly the virus progresses. So it starts by penetrating the mucous membrane, where it finds an activated immune system T cell. And these T cells that HIV is targeting are the CD4 helper T cells. Here, HIV multiplies very quickly within the tissue and then spreads to the intestines and lymph nodes. Unfortunately, the immune system cannot keep up with the virus, and this leads to a severely compromised immune system, as what we will see in patients with AIDS. During the initial acute infection, which occurs about 2 to 4 weeks after being infected with the HIV virus, a patient might experience mild symptoms such as fatigue, fever, and rash. And these are so mild that an individual might not even know that they are infected with the virus. And at this time, there are high levels of free HIV virus within the blood. The next stage a period of clinical latency, and during this time there is an abrupt drop in free virus level within the blood, although the CD4 T cells continue to decrease, but at a much lower rate. This stage is also characterized as asymptomatic, as there are no visible symptoms. This period is very varied and can last anywhere from 2 to 15 years, and on average lasting about 10. The final stage of HIV is the progression to AIDS, and this happens when the CD4 T cell levels fall below 200 cells per cubic millimeter. The symptoms of AIDS include fatigue, diarrhea, weight loss, neurological changes, and a severely compromised immune system, making them highly susceptible to opportunistic infections. Unfortunately, there is no treatment for HIV and AIDS, but there are therapies proven to slow the progression of the infection. These drugs help treat the virus itself as well as opportunistic infections that arise from having a severely compromised and weak immune system. The therapies used are called highly active antiretroviral therapies, also known as HAART. And what this is it's the use of multiple drugs simultaneously to interrupt the progression of HIV. This kind of targets the clinical latent stage, which is probably why you can see that stage can last anywhere from 2 to 15 years. It slows the rate of multiplication. And the use of multiple drugs really helps, as if one drug doesn't help progress the virus, then you have some backup. So while there is no cure, there are definitely some ways to prevent contracting HIV and AIDS. These are abstaining from sexual intercourse or practicing safe sex with the use of a protective barrier such as a condom, especially when your partner has HIV or AIDS. There's a high likelihood, or you don't know. When needed, always use sterile needles. And in the healthcare field, use the use of protective gear when working with individuals with HIV or AIDS where blood contact is likely. So scientists around the world are still trying to find treatments and cures for this disease, and today they're continuing to develop and test clinical drug trials, improved vaccine research, prevention strategies, and finally establishing best practices and better educational tools to educate the public about this infection and this virus.